Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. This is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. And I do this with my friend and colleague, Dr. Jon Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases around the world. Thanks, Jon, for joining me today.
It's great to see you, Jay. It's actually been 2 weeks for me because I was away last week, so it's
It
good to be back.
is. Yeah, and I heard that you were in Kenya. What were you up to in Africa?
Yeah, it was a really interesting trip. I was on the east coast of Kenya with the Turkana Basin Institute. A little shout out to them and the beleaguered and embattled Harvard University. I teach a field course out there on disease ecology, so I was spending a week with some Kenyan and American students talking about environmental impacts on disease emergence. It was a lot of fun. Really interesting time.
Yeah, and where along the coast were you? Were you on the coast north of Mombasa or?
Yeah, it was Malindi, which was I don't know, kind of east of Nairobi, about a 2 hour turboprop flight. It's
Yeah.
about all I know, but it
Okay.
was lovely. I mean, really beautiful, right on the beach there.
Yeah, no, it's a beautiful place. I mean, I think the last time I visited there was a couple of years ago when I was living in Ethiopia, and I think the risk situation around there was about terrorism, right? Like Al-Shabaab, and I'm
Right.
not sure how that situation was now, but hopefully it's gotten safer.
Yeah, it's a lot more stable now. I think it's become quite a touristy area. It was of interest because it's near Tsavo, which is one of the national parks where the students go in and learn about, animal ecology and invertebrate ecology before they head up to Lake Turkana, where they study fossil records and look at early human evolution. So it's a pretty great course. If I was a student, I'd be excited for it.
Yeah, and that coast, regardless of what the safety issue is, the coast is spectacularly beautiful. The water's warm. It's a lovely place. People are lovely.
Yeah.
It was one of those places where my family and I rented like a home for us and the kids, and the home comes with somebody who basically is a chef, and they go
Oh,
out and
yeah,
they
that's nice.
they go to the local, a local fishmonger comes in, and you pretty much have fresh seafood every day. It was really, yeah, quite extraordinary.
Yeah, it's always no matter what country you're in, being near the coast means fresh fish or seafood. It's totally worth it. It's such a nice thing to have. I mean, my accommodations were fine, but nothing like that. So that sounds like a treat.
It really was. All right. So, like, moving from East Africa to the middle southern part of the United States, our first segment today is about a disease called whooping cough, which again has one of those kind of like ancient names, well, I mean, they biologically referred to as pertussis. But that people think is a disease of the past, but in fact, we're seeing it return. And last week, the state of Kentucky announced that there were 2 deaths from pertussis, not just illnesses, deaths from pertussis in infants that have occurred over the past 6 months. Neither the infants nor their mothers had been vaccinated against this highly contagious bacterial infection. And according to Kentucky officials, whooping cough is on the rise throughout the states, with 543 cases reported in 2024, the highest number in over 12 years. And so far in 2025, they've already gotten to about half the number of cases they had last year. This is a disease that really is preventable with vaccines. All infants are recommended to get the pertussis vaccine series starting at 2 months of age. And pregnant women are also encouraged to receive it at every pregnancy. So, Jon, what do you think about the return of vaccine preventable diseases like pertussis?
I feel like we're a bit of a broken record here, but we're going to see more and more of vaccine preventable diseases cropping up in parts of the US where vaccine rates are low. It's something we're all really concerned about. Those of us who are paying attention to the decline in vaccine rates. And for some of these diseases, all it takes is enough people not vaccinating and you dip below that protective population level threshold, and we're going to see probably an acceleration of cases. So I feel like this is a bit of a tip of the iceberg moment where we're talking about these individual cases, but really when we look at rates, that's what we're going to see increase over time in the near term.
Yeah, and there was a survey done in Kentucky showing that for kindergartners and 7th graders, only about 85% of them are actually up to date on their immunizations for whooping cough. And there are some, issues that are worth highlighting here. The first is, why do we care so much about this? And the reason that we care about it so much is that infants, because they have very small airways and kind of underdeveloped immune systems are really susceptible to respiratory infections. And a disease like pertussis or whooping cough can devastate them. It can cause symptoms of swelling that sounds somewhat like asthma, but it's much more severe. And that's one of the reasons that we need to make sure that kids are up to date in their vaccination to reduce overall transmission in the community. But it's actually one of the reasons this is one of those vaccines that we recommend that women get when they're pregnant. We've recently seen a lot of anti-vaccine sentiment at the highest levels of government policy, kind of scaring pregnant women and saying you shouldn't get vaccinated. But in fact, we know that pregnancy is an ideal time to be vaccinated against a few specific diseases, and pertussis is actually one of them.
Yeah, that transfer of maternal immunity becomes so vital, especially when kids are most vulnerable in that first 4 to 6 months.
Yes, without question, and that's exactly what it is. It's when you vaccinate the mother, essentially what you're doing is you're providing what we call passive immunity. The mother is passing that immunity onto the baby until that baby's immune system is developed enough. And I really worry, as we've talked about a lot, is that you're seeing these declining vaccination rates. Some of them are due to people falling behind during COVID when a lot of doctors' offices were closed. People were worried about leaving their homes. But a lot of this is this incredible hardening of the anti-vaccine movement that's moved from kind of a fringe group to something that's essentially setting policy in the United States, as we've seen with the RFK's recent decision to essentially disband CDC's External Vaccine Advisory Committee. And I'll just be very blunt here, replace it with a bunch of quacks, people with no qualifications who are already ideologically committed to the idea that somehow infectious diseases aren't anything to worry about and that vaccines are more dangerous than diseases.
Yeah, this is one of those problems that's going to be insidious at multiple levels, where at the highest level, you have what was an expert group that had been functioning for decades at the CDC in looking at the science, making determinations about vaccine safety and efficacy, and developing protocols that would then get recommended and followed by the states and local health practitioners. Now you start to have people who are less qualified to do that, maybe predisposed to be skeptical of vaccine efficacy. That's a top level challenge. And at community level, the message people are hearing is that, vaccines are possibly risky. It's a personal choice, but there isn't, people make decisions also based on personal experience and the experience of those they trust. So as we see more cases of these childhood diseases, either people are going to unfortunately experience it with their kids, or they'll have friends who did. And maybe then it'll convince people to start, using more. Doctors will be recommending it because doctors' offices are going to get inundated too, as we have more kids who are getting sick and needing to see the doctor at the same time, as some of these are seasonal.
Yeah, and that's always been kind of the hope, is that we don't want people to get sick, but the hope is that seeing illness in the community, if it happens to occur, prompts people to get vaccinated.
Yeah.
And I really don't have a good sense of like what the future is, though, because that is one dynamic that plays out, right? Like, people see other people getting sick and they appropriately get concerned and make sure they and their family members are all up to date in their vaccine. Another aspect that gets played out, though, is especially in the way our information ecosystem has been so horribly broken and damaged, and people are really only hearing a slice of information and never get exposed to anything else. When you have extreme views like this that are no longer just occurring at the fringes, when they're literally sitting at the highest levels of government, I do worry that it sometimes hardens people, right? You saw during this peak of the measles epidemic in Texas that despite kids dying of measles, a disease that we shouldn't see any deaths from here in the United States, some people in the community were still like, you know what? I still think it's safer not to get vaccinated. And I think that's because they heard people that they thought they should be trusting saying things like that.
Yeah, and that's, you bring up a good point. Is another really dangerous message is the notion that it is somehow safer to get the disease, treat it, get through it, and then have some immunity afterwards. And that unfortunately really puts kids at risk because, sure, there's supportive care, but the disease is often way worse than the risks associated with the vaccine. That's why we do it. And you're putting kids needlessly at risk by not vaccinating them.
Yeah, it's just a complete, one of the analogies I use, I'm not sure it's the best one, but it tries to get the message across. If I'm hungry and you feed me a sandwich with like filthy meat in it, with E. coli and everything else, guess what? It's going to solve my hunger, but it's also going to give me a bunch of diarrhea and vomiting. If
Yeah.
you feed me that same sandwich and it's been cooked, the meat has been cooked, I'm going to solve my hunger and not get sick. And that's essentially what vaccines do. They give you the immunity that you will get from an infection without any of the side effects and adverse events. And so you have a choice. You can get the disease so you don't get it a second time, or you can get the vaccine, not get the disease then, and not get it in the future. And anyway, I know this is an issue that we're going to keep harping on, but I think in this situation, I think the message I want to really get out there is just the importance. If any of you are out there are pregnant, you're thinking about getting pregnant, or you have pregnant people in your lives, please make sure you spread the message that vaccines are safe during pregnancy. And some vaccines, like the pertussis vaccine, are absolutely necessary if you want to make sure your babies stay healthy, particularly in a time when this disease is spreading much more in the community than it ever was before.
And Jay, as a physician, you've probably seen cases of pertussis. It's scary as a parent. I mean, the cough is horrific sounding. It's really harsh and barking and loud. Kids are up all night. It's just not a fun experience. And there's no reason you'd want to put your kid through that.
No, it's essentially like strangulation. I mean, when you see these kids in the hospital, they're, like I said, it's like having a very severe asthma attack, but this is a very young baby. They can't communicate to you about the severity of their symptoms at all. And I will be very honest here. One of the challenges we have with this vaccine is you actually need to receive multiple doses of it. And the reason is because it isn't the greatest vaccine in terms of like some vaccines you just give it one time and some people have lifelong protection, like the measles vaccine. It used to be that only one dose was lifelong protective. So this is a vaccine that does require you to get multiple doses of it to stay protected, which is yet another reason to restore our faith in vaccines. You want to keep that protection because the consequences of it are very severe. Having a baby die is quite a bit different, of course, than somebody maybe who's very advanced age, they didn't get their flu shot and they die of the flu. Obviously, we want everybody to be able to live as long as they can. But when you look at babies, that's a group that I think everybody, regardless of your political affiliation, your values, every death of a baby is fundamentally a tragedy.
Yeah, that's something we can agree on.
So we're going to shift a little bit away from diseases of babies and things that we need pregnant women to get to a fungus that I, quite honestly, had not heard about before, but I do think it's an interesting topic for us to discuss because it's really about the politics of dangerous pathogens. And Jon, you have a lot of experience in this, as we will touch on in a moment. But let's start with the background here. The background is the Justice Department announced charges recently against 2 Chinese researchers, accusing them of trying to smuggle a fungus into the United States. The students arrived into the country carrying small bags of the fungus Fusarium graminearum, which causes a disease that can cripple crops, things like wheat, barley, maize, and rice. And as we know, the U.S. is a major producer of wheat and barley and maize and rice. Not only is it for feeding our own population, it's for exporting. So, Jon, what do you know about Fusarium graminearum, and why would the U.S. consider this a agro-terrorism weapon? And I turn to you as a disease ecologist, even though that you care more about non-human animals than you do about.
This is stretching the absolute limits. The answer is not a whole lot until I read about it. This is a crop disease, and so I tend to focus on pathogens of animals and people, but nonetheless, the principles here are worth talking about. This is an issue where we have a fungus that is incredibly pathogenic to crops that we depend on for sustenance and financially, economically. These are export crops as well. And although this is a fungus we do have here in the United States, we have dealt with outbreaks of it, the prospect of it getting potentially introduced into a field or a region in the United States where maybe it isn't currently causing problems could be very damaging. And it's very difficult to eliminate these pathogens, particularly fungal ones. They're hard to treat, hard to deal with. So what we have here is, for some reason, these students were found to be carrying this fungus. I think the article states that the reason was one of them was researching the fungus and wanted to take advantage of some laboratory space or infrastructure in the US to do work on it. Doesn't quite explain why he had some in his backpack versus, sourcing it locally if it exists here. So I'm not quite sure what's going on, but it does raise the discussion, the principles about biosecurity, and if indeed this was, carried with nefarious intent, the idea of deliberately somehow introducing it to an agricultural area, that could be incredibly damaging and harmful.
Yeah, and and in my reading, the damage is you both lose crops, as well as you contaminate them, and I think the contamination involves one of my favorite toxin names that I've ever heard of before, and this reminded me because I do remember learning about this in medical school, called vomit toxin. So if you
Pretty
contaminate.
much says it all.
And pretty much it's an incredible combination of words. Vomit and toxin gives you vomitoxin. And unfortunately, it has some similarities to my name, so I should be a little careful joking about it. But it is a real problem, so they refer to this as agro-terrorism.
Yeah.
You and I spend more of our time probably worrying about what we consider bioterrorism, which is biological agents that can be damaging to humans or to animals. But they largely have similar consequences when you think about the destabilization of societies. Like, yes, it's terrible to infect humans and animals and have them die. But if you cut off their food supply, you kind of almost end up in the same pathway as well, too. So there's a reason, the US government cares a lot about this. I remember one time, we lived overseas for a very long time, so used to come back and forth to the United States. And one time my son was coming back into the United States and got completely held up he was a teenager, completely held up in immigration and customs because he happened to have an apple in his bag and hadn't thought about it, but he was bringing it back from, I think we were living in Ethiopia at the time. And there is a very strict, restriction, as on bringing any types of fresh fruit or vegetables from other countries.
That's right. The U.S. Department of Agriculture has an Animal and Plant Health Inspection Service, APHIS, and this is probably one of their chief concerns is the introduction of not even just pathogens, but even seeds sometimes, and having an exotic plant that could be invasive and damaging get brought into the United States. But certainly they're also on the lookout for fresh fruits and vegetables that can carry pathogens that would be introduced. So we've seen it before. We've seen bee paralysis disease when we had the importation of infected honeybees from the Middle East, I think from Israel actually, that came in and started spreading disease and causing huge declines in our domestic honeybee populations, and that was a real challenge. And so it's the same thing whether you're talking about pathogens for domestic animals or for crops. The introduction, particularly the deliberate introduction of these, comes under the veil, as you said, of agro-terrorism, and it's a serious crime and it's a serious concern when we're talking about food security.
Yeah, and I think this is part of the dilemma of our current political environment is that I want to believe that USDA, that Justice Department officials are really acting in the best interests of protecting our crops, keeping our agricultural supplies safe. But we do have to keep in mind that there is a much larger crackdown occurring in the United States on anybody from a foreign country coming in here, particularly against Chinese students. The Trump administration had announced effectively a ban on anybody with a Chinese passport studying at a U.S. university. So, I don't want to be a conspiracy theorist, but I also worry sometimes that, is this really a genuine biosecurity threat, or is this more about, geopolitics as well, too? And it's certainly possible it might be both, right?
It definitely changes the lens through which we view these things, because unfortunately this will be used as an example of why we need to, prevent foreign students from coming in, because, and in this case from China because they brought something in. But I always want to kind of reserve judgment and see what the actual, story is here. Because it's easy to jump to conclusions that and assume the worst, but I think it's important to understand the circumstances fully. And if indeed they were doing something wrong, well, they've been caught and they'll be punished for it. And it's good that we have surveillance for this and that there's some vigilance towards it.
And Jon, you have a lot of experience, obviously, with this issue about transporting potentially dangerous samples like specimens
Mhm.
or actual pathogens themselves because of all the international collaborations you've done before in the past. What is your experience with that? And what are some of the lessons or the things that the
Yeah.
average person out there should know about?
I mean, that's a good point. If you're doing research on a pathogen or something and you're moving samples internationally, there's all kinds of regulations and ways to do it totally above board that you follow. You apply for the appropriate permits, you declare the specimens that might contain the pathogen or are known to contain the pathogen, you package things in a secure way so that there's no possibility of leakage or external contamination. So there's a whole host of things that you do to transport specimens safely when you're doing research. And so again, you don't throw them in your backpack and then get caught by, officials and wonder why it's there. So I think that, that certainly, presents the question in this case as to why he had this fungus, in samples just unsecured and in his backpack.
Yeah, I still remember I had to board a cruise ship when I was a EIS officer at CDC. These are the disease detectives. So I had to board this cruise ship in Curacao, of all places, which exotic location. Yeah, I got to fly from Atlanta to Curacao because there was a huge outbreak of norovirus, people vomiting and diarrhea. Eventually the ship, docks in Miami. And I had a bunch of specimens that I had taken from patients and some from the environment. So they could be taken back to Atlanta to get tested. And I remember showing up at the Miami airport, and this is, my, first, the beginning of my second year of a CDC officer, and they were going to prevent me from getting on the plane. And I still to this day don't remember exactly how I talked them into getting on that plane with these specimens, but I kept trying to make the point to them, everything that they're carrying in the toilet of that plane is just
It's the same thing. Yeah.
But I remember being like, look, I got these specimens and it's really just poop from humans. And I will bet you that it's no more dangerous than what's on that plane right now.
No, look, it's funny, regulations are there to protect and they serve a purpose, but sometimes they make it really logistically challenging to do the work you need to do. And that's just something, you have to navigate as a researcher. Similarly, when I've been doing investigations of disease in livestock in other countries, US has very strict policies about any kind of, living animals, but also products or specimens coming from certain livestock species into the US, particularly ruminants, because we're very concerned about another foreign animal disease called foot and mouth disease, which we don't have in the United States, but it is enzootic in other countries. It is present in animals. And if you're working with livestock specimens, even if you don't think that animal has foot and mouth, because there's a risk, because there's even the slightest chance that a sample may contain that virus, it has to go through one of our highest security foreign animal disease labs. Used to be Plum Island, New York. Now it's in Manhattan, Kansas. But the point being is you cannot transport ruminant samples from cows or goats or sheep into the United States for research purposes. They must be approved and go through our foreign animal disease lab under Homeland Security. So we really, really, really are careful about introducing disease into our livestock and our crops in the United States.
Yes, absolutely. And, on that note, I think we can, wrap up this week's episode. I think we've touched on kind of two ends of the spectrum here, right? We've talked about human diseases and the return of vaccine preventable diseases and the threat of diseases from other places. And I think that's one of the things that I enjoy and find the most interesting about public health and infectious diseases is you're dealing with a wide range of things, everything from, what could strike you any moment today, but also the risk, what we call low probability, high consequence events in the future.
Yeah, and I want to applaud you, Jay, for bringing a plant disease into the discussion because it's often a neglected topic, but it is just as important for our health and economic viability. So we should be also talking about plant diseases once in a while.
Of course. And especially if we're going to talk about vomitoxin, how can we resist? Okay.
Right.
And with that, if you like these discussions, if you like learning about public health and infectious diseases, if you want your friends and colleagues to learn more about these, please hit the like button. Please hit subscribe. Please share these episodes. It really helps us make sure that we can get the word out because the more we can protect everybody's health, I think the happier we're all going to be. So thank you very much for joining me today, Jon. And thank you all for watching today.
Have a great week.